Hi, this is Dr. Michael Lenz. I'm a pediatrician, internist, clinical lipidologist, and lifestyle medicine physician, and host of the Conquering Your Fibromyalgia podcast and YouTube channel. I'm doing a reaction to the Fit for TV, The Reality of the Biggest Loser. This is a documentary that just came out on Netflix, and thought I'd share some insights and education to add a evidence-based medical perspective.
Being on The Biggest Loser is just like winning the lottery.
Whoever loses the most weight wins $250,000. It was huge.
To see us in a gym yelling, screaming, that's good TV.
This is what America thinks is healthy and safe.
Being seen as a person and not just a body.
We were not looking for people who were overweight and happy.
I'm a secret eater.
We were looking for people who were overweight and unhappy.
Maybe it would fix my marriage. Maybe it would fix me.
I'll do anything to be on your show. The Biggest Loser!
They were really reinforcing the stereotypes.
People like making fun of fat people.
And producers love that.
You can't have a show based on weight loss that's safe.
I could barely walk, and I was in such pain, and they said, just walk it off, just walk it off.
I would never put anyone in harm's way.
The shame, being a failure after being a success.
Why didn't anybody let me know that I could have just ruined my life?
I think there's a bit of PTSD.
We're going to hear a clip from one of the biggest losers on the TV show and share some insights.
I'm overeater. I think I might have lost 1,000 pounds over the last 20 years, but I keep gaining it back. I lived it every day. There's so many things I can't do that I wish I could do. So many times I took my kids to the fair and they would get on a roller coaster I couldn't get on with.
This clip reminds me of an interview I did with Heather DeAngelis. She's a therapist in California who specializes in those struggling with eating disorders, especially binge eating, and uses acceptance and commitment therapy to help people navigate that. She also works with adults who have ADHD. She shared she has ADHD and how her ADHD impacted her food choices. She was using food as a way to cope with her deep felt emotions. And she shares how she had lost and gained over 100 pounds multiple times in her life. This gentleman's experience echoes Heather's as well, and makes you have to strongly consider that he may have some of those same struggles. If you can do it once, but then you fall for some of those highly palatable, calorie-dense foods and get this yo-yo dieting, it makes you have to consider. And as studies have shown that obesity is strongly connected with ADHD. In one study, 43% of those who had a BMI over 40 had co-occurring ADHD. And when they treated their ADHD with stimulants, there was a marked improvement, about a 13% in total weight loss, and was able to help control that impulsive eating. So while I'm not his doctor, it is something to strongly consider as a struggle similar to Heather's. And if you haven't checked out the interview with Heather, it's on episode 204 and 205, and you can check that link out in the show notes. This next clip looks at more than just the content of what somebody's eating, but the strong emotions that somebody's going through in trying to control their weight and to maintain at a healthy weight. And there's a huge backstory of what's going on. The next clip, the producer shares where he came up with the idea to do the show in the first place.
But for me, this was my one chance to save my life. I was working out, heading back into the men's locker room, and right outside the door, there was a bulletin board. And there was a note on the board that said, "Help needed. Please help save my life. Obese person seeking train." And I stared at it and I said, that's it. That's the show.
This story is both inspirational and hopeful. A handwritten note asking for help and someone responding to it. That's powerful. For the person who wrote that note, it truly was a cry for life. And in many ways, it's moving to think that this sparked a chance for people struggling with obesity to be seen. But we also have to ask, where did it go from there? Somewhere along the way, entertainment got entangled with health. Instead of centering around the best evidence for long-term weight management, the show leaned into drama, extreme tactics, and public spectacle. So while the origin feels like a heartfelt attempt to save lives, the execution raises the question, was this really about health or about ratings? And was it always the best evidence-based approach for sustainable weight loss?
For taking drugs, but it's what I imagine it would be like to get a fix, to like, shoot up the heroin or smoke the crack, and for just that few minutes while meeting the difference.
This clip is powerful. The contestant compares eating donuts to the high someone might get from heroin or crack. And while that may sound dramatic, neuroscience actually supports the comparison. For some people, eating highly processed sugary foods light up the brain's reward pathways in the same way addictive drugs do. What he's describing really fits with binge eating disorder, which is the most common eating disorder in the United States. The criteria include episodes of eating unusually large amount of food in a short period, feeling a loss of control during the binge, eating rapidly or until uncomfortably full, often eating alone due to shame, and then feeling guilt or distress afterwards. These episodes happen at least once a week for 3 months to meet the diagnosis. The key point is that this isn't always about willpower. It's a recognized psychiatric condition where treatment's helpful. The good news is that we do have evidence-based treatments. Therapy approaches like cognitive behavioral therapy and acceptance and commitment therapy can be effective, but medications also play a role. In fact, the first FDA-approved medication for binge eating disorder is lisdexamfetamine, brand name Vyvanse. In randomized controlled trials, Vyvanse reduced binge eating days per week significantly by about 50 to 60% compared with placebo. Many participants also lost weight, though the main focus was reducing binge episodes. For some patients, stimulants help by lowering impulsivity and reducing the strong cravings that drive binging. So when we hear someone say that eating donuts feels like they're doing drugs, that's not exaggeration. That's the lived reality of binge eating disorder, and it deserves real treatment.
The first season, we were flying a plane while building the plane.
The producers didn't know.
That line, "we were flying a plane while building the plane," really says it all. The show launched without a clear blueprint, and it sounds like the producers didn't exactly know what they were doing from a medical or safety standpoint. When you're dealing with people who have diabetes, obesity, high blood pressure, health conditions like arthritis, you can't just wing it. Safe weight loss requires structured, evidence-based guidance. You need medical oversight, nutritional counseling, behavior support, and gradual sustainable changes. Instead, it sounds like the approach was trial and error, figuring things out as they went, while the contestants' health and safety were on the line. That might make good TV, but it's not responsible health care.
In the end, it worked out great because I won, but I was doing what most doctors would say were super unhealthy things. The last 10 days, I didn't put any food in my body. I was just doing the master cleanse, just drinking lemon juice and maple syrup and cayenne pepper, all these tricks that are super unhealthy just to cut weight. At the final weigh-in, we had to do a urine test. They said, "Ryan, there's blood in your urine," which is obviously means you're so dehydrated. The one thing I really remember is Jillian's congratulating me. She gives me a big hug and she says, "Ryan, you just made me a millionaire."
This is such a troubling clip. He admits he went 10 days without real food, surviving on a so-called master cleanse of lemon juice, maple syrup, and cayenne pepper. Your body has organs in it dedicated to cleansing you. You have your liver, you have your kidneys, you have your lungs. And doing this diet, it's not sustainable. It's downright dangerous. By the finale, he was so dehydrated there was blood in his urine, which is a sign of kidney stress and potential organ damage. What's even more concerning is the reaction. Rather than being alarmed, the focus was on winning and the financial gain for the trainers. That tells us the priority wasn't the contestants' health, it was the spectacle and the ratings. From a medical standpoint, crash diets like this don't create lasting results. The body responds with severe metabolic slowdown, loss of muscle, electrolyte disturbances, and a near guarantee of rapid weight gain. Compare that to evidence-based approaches like the Broad study out of New Zealand, where participants lost weight and improved diabetes control by eating a whole food, plant-based diet without counting calories or starving themselves. That's safe, sustainable, and actually improves long-term health outcomes. So yes, he won the game, but at what cost? That moment is a stark reminder that extreme tactics might get short-term results, but they can cause real harm, and they don't fix the root causes of obesity.
The idea of being on The Biggest Loser, I felt like would
maybe it would fix my marriage. Maybe it would fix me. Maybe it would make me a better mom, a better friend. I felt like my weight and everything about it was just something that constantly was bringing me down. I wanted to change my life. I do feel like at that time that it was like my only hope.
This clip really gets at the emotional weight that often comes with physical weight. She wasn't just hoping to lose pounds, she was hoping that by changing her body, she could fix her marriage, be a better mom, a better friend, and maybe even fix herself. The sense that this is your only hope is something maybe familiar to you or somebody you know. Obesity is so often tied to shame, stigma, and the feelings that it defines your worth. But here's the truth. Weight alone doesn't determine whether you're a good parent, a loving partner, or a valuable person. The danger is when a show like this plays into that desperation, promising transformation through extreme methods without addressing the deeper issues like self-worth, trauma, mental health, or conditions like ADHD and binge eating disorder that can really drive unhealthy patterns. Real sustained health changes happens when we treat the whole person.
What is a temptation? A temptation is real life. I can't say that 100% of the temptations we got right, but I can say that life is full of temptations. I needed the show to be relatable to the rest of the world who aren't in this dome that we've created. You pass a cupcake in your refrigerator or on your counter, or you pass that fast food store or restaurant on your way home from work.
I'm not here to candy coat things. You're too young to have high blood pressure, elevated cholesterol, and you know what else you got? You got diabetes.
This setup was cruel. Putting contestants in a room full of junk food wasn't about helping them. It was about creating drama for TV. It wasn't done with pure intentions or with the contestants' health in mind. The psychology here connects with what's called the pleasure trap. Our brains are designed to seek calorie-dense foods. In today's world, where hyper-processed foods and lots of inexpensive animal protein foods like cheese and meat are available everywhere, and that same design gets hijacked. Here's the hopeful part. Over time, when people consistently eat lower calorie-dense, highly nutrient-dense whole plant foods, their taste preferences shift. What once seemed bland actually becomes satisfying, and the hyper-sweet, hyper-salty foods start tasting overwhelming. The brain can reset its pleasure pathways. But for those with addictive tendencies, a single re-exposure can activate old cravings, almost like resetting the pleasure equilibrium. That's why creating supportive environments is so important. The show wasn't teaching people how to reshape their brains or protect themselves from the pleasure trap. It was manufacturing temptation and shame for entertainment, not building lasting health. The show physician delivered the diagnosis almost like a punishment, scolding and shaming. Now the facts themselves are serious. Hypertension, high cholesterol, type 2 diabetes at a young age absolutely deserve urgent attention. But the way it's delivered matters just as much as the information itself. Shame does not motivate sustainable health change for most people. It often drives people deeper into hopelessness and secrecy or even disordered eating patterns. What actually helps is compassionate, evidence-based care. Patients need to understand that these conditions are treatable, even reversible, especially with changes like adopting a whole food plant-based predominant diet, regular activity, and stress management. When patients are supported rather than shamed, their outcomes are better. Instead of, you've got diabetes, the message should be, you're facing serious health challenges, but there are powerful tools we can use together to help you get back control of your health. That's empowering, not humiliating.
You all are going to race. She's like, you're going to run on the beach today. The final mile of the biggest prison marathon.
Run a 1 mile race.
If you get across the line, you are on the show. And if you don't, you're not on the show. Very high stakes.
I never thought it's that. In my head, I'm like, I could run. I have 4 kids. They're running after them all the time. But it was the longest mile ever. That whole day on the beach starts out with like this enthusiasm and we're all cheering for them.
She was like that determined. I thought I was determined. Watching Tracy sprint up that hill, she was determined.
I'm running and my legs feel really heavy, like lead. My legs are so weak. What's happening right then is my body's starting to shut down.
This clip is alarming. What starts out as an enthusiastic endeavor to win this race, this 1 mile race, she's thinking she can do it. Her memory is good. She remembers running in the past when she was younger and in better shape. but it reflects a very real medical condition called rhabdomyolysis. Rhabdomyolysis happens when muscle tissue breaks down rapidly, often from extreme exercise, trauma, or dehydration, and releases its contents into the bloodstream. One of those contents is a protein called myoglobin, which can clog the arteries and lead to acute kidney failure. Electrolytes like potassium can also spill into the blood, which in severe cases can trigger dangerous heart rhythms. When this contestant says, "My organs were shutting down," that's not an exaggeration. First, the liver can show signs of stress, and the kidneys struggle to filter the overload, and if untreated, it can ultimately affect the heart. This isn't just a scare story. It highlights the danger of pushing the body beyond safe limits. Rapid, extreme exercise regimens under dehydration and malnutrition conditions, like what we often have seen in The Biggest Loser, can trigger exactly this type of breakdown. From a medical standpoint, safe training should prevent, not cause rhabdomyolysis. It's a reminder that sustainable, progressive lifestyle changes are far healthier and more effective long-term than shock and awe approaches that put contestants' lives at risk. Some early warning signs of rhabdomyolysis include dark urine, severe muscle pain, and weakness.
My organs were literally shutting down. I didn't realize that I had rhabdomyolysis. And rhabdomyolysis is your body's way of saying, I'm going to shut down on you. It started with my liver, then it went to my kidneys, and then it goes to your heart. Doctor's telling me, if these legs don't drain, we are going to cut your legs open so that they can drain. You're going to do what? Doctor's telling me, if these legs don't drain, we are going to cut your legs open so that they can drain. You're going to do what? You're going to cut my legs open.
What she's describing is something called compartment syndrome, and it's terrifying, but it's also very real. Compartment syndrome happens when pressure builds up in certain compartments or regions in the body, like the lower legs. This occurs often from swelling or bleeding, so much so that blood can't circulate properly. If that pressure isn't relieved, the muscles and nerves can literally die. When doctors say we have to cut your legs open, they're talking about a procedure called a fasciotomy, where surgeons open the muscle compartments to release the pressure and save the tissue. It sounds drastic, but without it, amputation or permanent disability is a real risk. I can relate to this on a very personal level. During my medical residency, I developed compartment syndrome. I was playing basketball and went out to try to play defense on somebody at the top of the free throw line. And I sprinted out and I suddenly put weight on the ball of my feet and my heel was pressing down at the same time, called an eccentric contraction. That sudden movement tore a calf muscle, which I wasn't aware of at the time. It felt like I got kicked badly in the back of my calf. The swelling built up over the next 12 hours where I could barely dorsey or plantar flex, which was bend down or pull back my foot. I limped into the hospital expecting that I was actually going to have this fasciotomy. It's one of those situations where you realize how fast things can go from just routine activity to a life-threatening emergency. Fortunately for me, the surgery went well. I've recovered, ran a marathon about 6 months later. So when she talks about hearing that her legs might need to be cut open, I know how shocking that sounds. But in medicine, that surgery is literally the difference between saving or losing a limb. One of the other contestants who has been struggling with fertility and pregnancy shares one of the real reasons why she wanted to be on the show. And this may relate to many of you who are struggling with fertility.
At that point, my husband and I were not able to get pregnant. I was told no children for you because of the weight. The core truth of why I'm here is because I have been married for 13 years. I'm 35 years old. And I want children more than anything.
Fertility is affected by obesity. In fact, recently, with the GLP-1 agonists and the significant amount of weight loss that have occurred with them, some women unexpectedly were able to become pregnant when previously it was found to be very difficult.
As we gained the weight, you'd burn more calories just by sitting. That's not what happened.
The New York Times made the claim that the Biggest Losers' metabolic rates, their metabolism, was permanently damaged to the tune of 400, 500, 600 calories.
Now that can sound depressing. What we do know is that marked weight loss, sudden weight loss, can actually put your body into a state of preservation, trying to restore calories and not burn a lot of calories. If you ever watched the show Alone, that they're surviving in some desolate area all by themselves with limited resources. It's often in a place like Canada where it gets relatively cold at winter. And so they're literally in a starvation mode. And when you listen to the people on the show, they're actually doing less exercise. They're having to conserve so much because their bodies literally has little energy to do movement. The good news is we know that the food choices can actually amp up your metabolism if you do have access to food. And the foods that tend to give you a discount, so to speak, on metabolism are whole plant foods. So let's say you get 100 calories of some vegetables. It turns out it's probably about a 10 to 12% discount when you look at the amount of calories based on this thermogenic effect, the process of digesting and breaking down that food, versus something that's pure fat or animal protein. It's going to give that full 100 calories. Well, that 12% may not seem like a lot, but over time it can make a big benefit. And it's actually very healthy because it has all the other plant phytonutrients in there that's so essential and so helpful.
But I know I'm the one who's put this food in my body. I've had a lifetime of gaining or losing weight. My metabolism was probably already messed up before I did The Biggest Loser. But
one of the key points, it's not the exercise that gets you the sustained weight loss over time. It is the food you eat. The food you eat, not how much food you eat, so much as it is the type of food you eat.
Bob Harper is in recovery after suffering from a massive heart attack.
Major health scare for Bob Harper, the Biggest Loser star and fitness guru, revealing he suffered a massive heart attack.
The heart attack happened while Harper was working out earlier this month.
It turns out that a lot of people can exercise at very high levels, may even pass a stress test and still end up having a heart attack. I'm a clinical lipidologist as well as a lifestyle medicine doctor. And one of the big reasons I got into that is because I discovered at a very early age, around age 33, that I was genetically prone to develop heart disease. I had inherited a lipoprotein A, which it turns out Bob Harper had as well. I had a heart scan at age 33, which I would not recommend in men under age 40, but I ended up getting it. And it showed a small amount of calcium deposits reflecting very early atherosclerosis, which is not surprising in retrospect due to family history of heart disease. I had a moderate elevation of high sensitivity C-reactive protein. I went on a statin and subsequently went on a whole food plant-based diet in addition to that due to the combined effort in helping prevent and reverse plaque in their arteries. I also discovered that I had a high amount of this small, dense LDL particles that would not have shown up on a regular blood test. And when I got this more advanced testing, that combined with the other tests put me on a course to not only slow down the progress of plaque development, to actually reverse it, and can be confident that where my levels have been at for over 20 years, I am at that reversed level and likely should never have any cardiovascular event related to atherosclerosis.
One thing I've learned is that, yes, have I gained weight? Yes. Have I been a loser once? But this is not over. And to keep pushing. It's not about how quickly you do it, but staying the course. Staying the course.
I will become the man who lost the biggest amount of weight ever on your show. So what's next for me?
I think this sums it up. What's next for the contestants on The Biggest Loser, most of whom have gained a lot of their weight back, if not all of weight, and some more. And so what's next for you if you're wondering what I can do? I think working with a dietitian can make a big difference. Working with a lifestyle medicine doctor can make a big difference. And just start with small steps and gradually increase that over time, or jump into this, but not the drastic, a large amount of exercise. But for some people, if you're willing to dive all in with a whole food plant-based diet, your body and your taste buds can adjust to that. And you often start getting the results. And next thing you know, you're gradually losing a couple pounds a week. Add some more exercise to that, and you may be losing 2 or 3 pounds. I hope that this and all of my other videos have been helpful for you. If you found that this has added value to your life and understanding, hit the like and subscribe button and share this with others. Until next time.